Welcome back to your video with Professor Shambly. Thank you for your active participation this week. There is a takeaway that I want you to learn from this episode, and that is that yes, our hypothetical showed some truly awful behavior with replacing animals and other violations of regulations. But you'll notice that in some cases, FDA didn't take particularly firm, strong action against the perpetrators. That doesn't mean that there weren't other avenues to pursue. It doesn't mean they weren't driven out of business. But when FDA has to face the reality of removing drugs from the market that affect patient health and safety by making the drugs they need less available, or more expensive, or even not available at all, FDA does not have to do that. There are other options. Now, as a regulatory professional and a compliance and enforcement advisor, it's important to know that bad things that your company doesn't necessarily mean your product goes off the market. It doesn't necessarily mean FDA enforces the violations. Now, as we saw with Theranos, if there are investors who are infuriated by being tricked and lied to, they have repercussions. There are SEC criminal laws against lying to your investors and in your filings to the SEC. So FDA isn't the only police officer in the arena, and there are other options. But for FDA purposes, it's important to remember that there might be ways to salvage the regulatory violation. Now, in the case of the GLP labs that we talked about, many of these drugs were already on the market. The purpose of the animal testing was to prevent dangerous drugs from getting into humans. Well, that works in a phase 1 situation, but it didn't work here. The drugs were already getting into humans. Now, assuming that the adverse event reporting is robust, which is not a safe assumption, but assuming that it's robust enough for us to trust it, what we can do is take some comfort in knowing that even if the laboratory data was false, it doesn't mean the underlying product would have failed its laboratory testing had it been done properly. It doesn't mean that the drug product that came out of it didn't provide some relief for the patients. And it doesn't mean that all the drugs have to come off the market. Now, this is not always a happy ending for manufacturers. It means that if your manufacturer is willing to invest in a good quality system, they are competing with someone who isn't. And the reimbursement structure that the government in the United States uses is set up to reward the lowest bidder, or the person who can provide drugs at the lowest cost. That's why hardly any drugs are made in the United States anymore, for those cost purposes. But for the purpose of good laboratory practice, the poor conduct in this case would probably mean that those drugs would never have gotten to phase 1. And where the fraud is discovered after the fact, after the drugs have been in humans, where the GLP test didn't prevent humans from taking these drugs, at least if the adverse event reaction system is robust, they would have found out about that through that system. And where they didn't find out that there were adverse events, whether the drugs were not potent enough or super potent, there's a possibility to presume that the drugs did what they were intended to do. So bad things happen, and as a regulatory professional, you'll see a lot of it. And it doesn't mean that everyone's going to jail and the whole process blows up. Now, it might be a good deterrent to have people who don't want to comply believe that. But if you're brought in to fix the mess, you can be a calm influence and say, I've seen this happen before, maybe be even worse in my class, and there's a way to fix it. In my experience, they don't bring regulatory people in before the disaster, but only afterward. So this will provide you a chance to be the level-headed person in the room that can help work with FDA and work with your company to fix the issues going forward. So I hope that's one level of comfort you can get out of this session. And now we're going to go ahead with good clinical practices and see what can go wrong there. Thanks. Let me know if you have any questions. Bye.